Hello, my name is Jacob Hopkins, and I'm a student at California State University Long Beach, and today I will be discussing the training of the patient care experience in California. In this presentation, I will describe what the patient care experience in California is. I'll define the term as well as list benefits of maintaining a good experience. I will talk about the importance of the good medical experience in relation to the patient as well as the physician and other staff. I will talk about strategies to maintain an acceptable positive level of outcomes, as well as the differences between patient care experience and patient satisfaction, and activities that can lower the patient care experience. Most importantly, I will discuss the critical factors that affect the patient care experience and what can be done to maintain a good experience by most patients. To begin, the patient care experience encompasses a vast array of medical-related interactions that a patient has regarding their healthcare experience. This includes all medical-related tasks, from scheduling an appointment to seeing a specialist and everything in between. Any issue with a patient, simple or chronic, in some way will deal with the patient care experience, and professionals are constantly working to have these experiences be the best for the patient as well as the healthcare provider. Many areas of struggle for healthcare providers include having this experience be fluid and easy to maneuver regarding the patient's experiences, especially from one facility to the next. Many healthcare personnel are working to mitigate the amount of struggle and dissatisfaction in this area, as well as the confusion regarding these transfers. Former Senior Vice President Dr. Laura Spence of the University of Health in Utah stated that medical care can only be great if a patient believes that it is great. She then challenged her medical leaders to hone their focus on the patient experience. To me, this is important because the level of care can be great, but if the patient doesn't feel heard, at the end of the day, they still might be dissatisfied with their level of care. So it is always important to make sure that the patient feels like their experiences were great, meaning they should feel educated and involved with their decision making, as well as safe and heard by their physicians. Today, many organizations strive to continually raise their bar when it comes down to the patient care experience. Cipher Health, a patient engagement company, strives to weaken the many barriers preventing people from receiving their best care. They focus on critical components of the patient care experience, stated by Lisa Romano, Chief Nursing Officer. Certain steps and procedures can be followed to maintain an adequate level of patient experience. When it comes to the patient care experience in California, there are many aspects or factors that can lower the overall experience. These all pose a problem against the comfort and ease of the patient experience regarding their healthcare. Training and overall preparation of the staff of a healthcare facility can prepare them to handle experiences the best way that they can. Today, many surveys are used in the healthcare setting to collect patients' feedback that can be used to try and identify sources of problems that patients find while in their healthcare organization. These surveys cover topics regarding their entire stay, as well as allow the patient to leave feedback or complaints regarding their care. Major areas that should be focused based on surveys from CHAPS and the Agency of Healthcare Research and Quality include but are not limited to long wait times, difficulty and confusion regarding transfers, and lack of communication between the physician and the patient. It has been noted that many areas of experience related to quality measures that should be evaluated regularly and improved to maintain positive and comfortable environment for their patients. To combat the negative patient care experience in California, medical organizations have a variety of strategies. As described above, Cipher Health states that many poor experiences are because of the stress and confusion related to healthcare. During some of these times, patients are overwhelmed with information, and one interaction between the physician and patient may not be enough for the patient to feel in control. The more time the patient is given with the physician, to get questions answered and request information, the better equipped they feel to transfer to a new location. With technological advancements making their way to healthcare, many tools can assist in the area, like recording discharge instructions or allowing it to be in the patient's portal so they can access it easily. Feedback must be constantly monitored and analyzed to discover other areas that can be improved upon. Many times in these surveys, patients feel a lack of communication or connection, and these can be focused on to make the patient care experience a little bit better. Thank you for hearing my speech today. I hope that you have a better understanding of the patient care experience and a couple of solutions on how to properly train your staff so that you can have the best outcomes regarding the patient care experience in California.